Hi everybody, my name is Lauren Hablitz. I'm an assistant professor at the University of Rochester in the Center for Translational Neuromedicine, which is a big fancy way of saying I study the brain and what happens in it. My area of expertise is actually circadian timing. So how does your body tell time? How does it know when it's sick? How does it know when it's healthy? And one of the things we really focus on is the glymphatic system, which is a network of perivascular fluid movement. So cerebrospinal fluid movement along the blood vessels. One thing we wanted to know is common circadian interventions like light and melatonin and timed food and drugs that target like the central clock in every cell, do they affect glymphatic function? And what we found is if we give these interventions at the correct time, we get more cerebrospinal fluid going into the brain. Okay, this is great, but how do we actually fix it? And so we started thinking about diseases that had both a glymphatic phenotype, where fluid in the brain is stagnant, along with a circadian phenotype, where if you look at activity across the day, it maybe isn't consolidated into sleep and wake the way it should be. One of the best models we found was with stroke. And so we used mouse models of stroke, specifically photothrombosis, where you inject a dye called rose bangle, shine a green laser, and it causes blood clots mostly in the capillaries. We also used middle cerebral artery occlusion, where we put a big ligament up the middle cerebral artery and block blood flow for a little bit. It was transient, about 20 minutes. And what we found is if we used either KL001, which is a small molecule modulator of the circadian clock, or time-restricted feeding specifically during the active phase, so like when the animal should be awake, it's eating food, we can reduce stroke volume in these mice, we can improve how well cerebrospinal fluid gets into the brain, and we can improve motor behavior and circadian timing in these animals. And so what's really cool about this is it was actually introduced 3 days after stroke. So this is like when the mice are already super sick, when the mice have open blood-brain barrier. These interventions are in the recovery phase after stroke, which is normally when we can't treat patients because stroke interventions typically have to be given immediately after stroke. And so in summary, our big model is in stroke, circadian rhythms are disrupted. Sleep and wake is not consolidated the way it should be. If we give these circadian interventions like KL01 and time-restricted feeding, we can actually improve glymphatic function, improve brain recovery and stroke lesion volume, and we can improve motor behavior. Hopefully this can eventually be implemented in the clinic. Thank you for your time.